to everyone. This is me, Angie Paragoso, and we are the group assigned to discuss to identify the disability categories served under IDEA and DepEd categories. So let us introduce to all of you the first IDEA acts and setbacks and relax. The IDEA Acts, or the Individual with Disability Education, is the act that makes available free appropriate education. The IDEA Act simply means that this law makes available for appropriate to eligible children with disabilities throughout the nation. Why? Because this law ensures to those students who have special disabilities to given such special educations and services. And now let's proceed to the orthopedic impairment. This severe impairment of the bones or muscles affects a child's educational performance. This student suffers severe bones deformation, bone abnormalities, and distortion. When teaching this, we must carefully arrange the room so that the student have a clear path and also allow them to leave early. Second is the multiple disabilities. These multiple disabilities are simultaneous impairments such as intellectual disabilities and blindness occurring at the same time. These involve the visual, the hearing, physical, intellectual, and many more. Teaching this, the teacher must provide accommodations and also provide needed modifications for the students. Other health impairments includes a range of conditions such as having limited strength, vitality, or alertness due to acute health problem. Academically, the students mostly have troubles due to their ADHD, which leads to lack of concentration. When teaching this, we must provide accommodations to the children and also the assistance technology or modify behavior for students. And now I will get the turn to the next reporter.
Good day everyone, my name is Felix Imorelio and I will be report the assigned topic that be given to me, the autisms and the deaf blindness. Autisms, also called spectrum, it is a developmental disability significantly affecting verbal and non-verbal communication and social interactions. Autisms are engaging in repetitive activities and stereotype movements, resistance to environmental change or change in daily routines, and unusual responses to sensory experience. And it covers a wide range of symptoms, but it mainly affects a child's social and communication skills. It can also impact the behavior. Deaf blindness, a concomitant or simultaneous hearing and visual impairments. It causes such as severe communications and other developmental and educational needs that they cannot be accommodated in special education programs. It can often lead to genetic conditions that called Usher syndrome, which affects the childbirth. Their communications and other needs are so unique that the programs for just the deaf or blind can meet.
My name is Vincent Ron Empanmero and I am assigned to discuss hearing impairment and intellectual disability. Now first, let's define hearing impairment. An impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance but it's not included in under the definition of deafness. So basically, hearing impairment defined as diminished acuity to sound. When we say acuity, it means sharpness or keenness of thought, vision, or hearing. Now, obviously, people who have this condition will suffer from inability to hear sounds in the speech frequency. Hearing impairment occurs when there are problems with or damage to one or more parts of the ear. A person has trouble hearing clearly, understanding speech, and interpreting various sounds. But in many cases, hearing impairment can be addressed through the help of hearing aids that can help the person hear normally. Next, common causes of hearing impairments for students. First is ear infections, ototoxic, meningitis, measles, encephalitis, chickenpox, influenza, and lastly, mumps. So now let's proceed to intellectual disability. It's a significantly sub-average general intellectual functioning existing concurrently and with deficits in adaptive behavior and manifested during the developmental period that affects a child's educational performance. To begin with, intellectual disability involves problems with general mental abilities that affects functioning in two areas, which is intellectual functioning and adaptive functioning. Intellectual functioning such as learning, problem solving, and judgment. And the other one is adaptive functioning, which is the activities of daily life such as communication and independent living. In general, intellectual disability will affect the functioning of your brain and your cognitive skills and how you perceive the things around you. The best way to handle or teach these students with this condition is to set attainable goals, self-awareness, tactful coping strategies, and identify their strengths. Furthermore, diagnosing intellectual functioning is assessed through the help of a doctor with a standardized testing which we use to know the IQ level of the patient. Next is levels of intellectual disability. First is mild, who has an IQ level of 52 to 69, moderate, who has an IQ level of 36 to 51, severe, who has an IQ level of 20 to 35, and lastly, profound, who has an IQ level of 19 or below. Next, the most common causes of intellectual disability. First is genetic conditions. This includes things like Down syndrome and Fragile X syndrome. Next is problems during pregnancy, problems during childbirth, and lastly, illness or injury. So that's all. Thank you.
So good day everyone. My report is all about the deafness and emotional disturbance. Deafness. Deafness is defined as a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing with or without amplification. Thus, deafness is viewed as a condition that prevents an individual from receiving sound in all or most of its form. The characteristics of deafness. Some of the common characteristics of deafness commonly found in classroom include the following. First one is the difficulty following verbal directions. Second is difficulty with oral expression. Third is some difficulties with social or emotional or interpersonal skills. Fourth is will often have a degree of language delay. And last is often follows and rarely leads. There are four major ways in which hearing loss affects children. The first one, it causes delay in the development of receptive and expressive communication skills or the speech and the language. Second is the language deficit causes learning problems that result in reduced academic achievement. Third is communication difficulties often lead to social isolation and poor self-concept. Fifth is it may have an impact on vocational choices. So what you can do? Recent research indicates that the children identified with a hearing loss who begin services early may be able to develop language or spoken and or signs on a par with their hearing peers. If a hearing loss is detected in your child, early family-centered intervention is recommended to promote language or speech and or sign depending on family choices and cognitive development. Emotional disturbance. The emotional disturbance means a condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects a child's educational performance. An inability to learn that cannot be explained by intellectual, sensory, and the health factors. So there are characteristics of students with emotional disturbance. The first one is rebellious actions such as taunting, early sexual activity, and the smoking or drug use. The second one is frequent arguing or aggressive attitude, tantrums, and unnecessary fighting. The third one is learning difficulties where students are performing below a grade level. Fourth is withdrawal from peer interaction and hostility towards authority. Fifth is immature behavior such as crying, tantrums, and lying. And lastly is the inability to cope with environment, which is the anxiety, mood swings, and the threatening others. Some of the characteristics and behaviors seen in children who have an emotional disturbance include the hyperactivity or the short attention span or impulsiveness. The second one is the aggression or the self-injurious behaviors or the acting out and fighting. And the last is the withdrawal or not interacting socially with others and excessive fear or anxiety. Emotional disorders are typically treated with a combination of medications and psychosocial interventions, so including cognitive behavioral therapy, family psychoeducation, and social skills training, interpersonal psychotherapy, or relaxation training. So that's all, and thank you.
Specific learning disabilities. A specific learning disability is a disorder that interferes with a student's ability to listen, think, speak, write, spell, or do mathematical calculations. Students with a specific learning disability may struggle with reading, writing, or in math. The term specific learning disability is commonly used in a federal state law, the Diagnostic and Statistical Manual or Mental Disorder, also called as DSM, and by many private and public schools. Types of specific learning disability. Specific learning disability is an umbrella term that can be described many different types of learning issue. An educational evaluation may show that your child has specific learning disability in a certain subject area. 7 learning disabilities. First, a specific learning disability in reading, also known as dyslexia. A specific learning disability in writing, also known as dysgraphia. A specific learning disability in mathematics, also known as dyscalculia. A specific learning disability in sound, also known as auditory processing disorder, or also called as EPD. A specific learning disability in language, also known as language processing disorder. A specific learning disability in speaking is also known as nonverbal learning disabilities. Specific learning disability in poor hand-eye coordination is also known as visual perceptual or visual motor deficit.
Visual impairment including blindness. Now first, let's define it. Visual impairment means an impairment in vision that even with correction adversely affects a child's educational performance. The term includes sight and blindness. So basically, when we say visual, it refers to the condition of our eyes which is not good. It's described to any kind of vision loss. Visual impairment is a decrease in the ability of a certain person to see a specific degree that causes problems to him or her. Individuals with vision impairment are more likely to experience restrictions in their independence, mobility, and educational achievement, as well as increased risk of falls, fractures, injury, poor mental health, cognitive deficits, and social isolation. In addition, as what I have said a while ago, Visual impairment will also affect the education of students. Generally, they are slower than others in completing reading tasks. In conclusion, students who has visual impairment should be guided properly. Encourage the student to use visual aids or resources like glasses, magnifiers, or bigger print books. Seat the students appropriately in the classroom. Make sure that the lighting is suitable for them. Next is make efforts to eliminate risk of glare from the desk and whiteboard. Next is blindness. Blindness refers to the state of being unable to see due to injury, diseases, or genetic condition. Blindness is a lack of vision. It may also refer to loss of vision that cannot be corrected with glasses or contact lenses. Next is causes of visual impairment or blindness. First is uncorrected refractive errors, cataract, age-related macular degeneration, glaucoma, diabetic retinopathy, corneal opacity, and lastly, trachoma. Now next, let's proceed to signs and symptoms of visual impairment and blindness. Constant eye rubbing or chronic eye redness, extreme light sensitivity, squinting, closing one eye or misaligned eyes, poor focusing or trouble following objects, inability to see objects at a distance. Now that's all, thank you.
Hi everyone, I am Educ53, and our next topic for today is all about speech or language impairment. So what is speech or language impairment? It is a communication disorder such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects a child's educational performance. So first communication disorder is the stuttering. A stuttering is an example of a fluency disorder, and other fluency issues include unusual word repetition and hesitant speech. Next communication disorder is the impaired articulation. It indicates impairment in which a child experiences challenges in pronouncing specific sounds. Third is a language impairment. It can entail difficulty comprehending words properly and expressing oneself, and also in listening to others. Last is a voice impairment. It involves difficulty in voicing words. For instance, throat issues may cause an abnormal soft voice. So we have also here the types of language disorders. Types of a language disorder refers to impairments in the ability to understand or use words in context, both verbally and non-verbally. We have here the types of language disorder: the expressive, receptive, and the mixed. First is the expressive. Difficulty in expressing ideas or needs. And the receptive is a difficulty in understanding what others are saying. And last is the mix. It involves a mix of expressive and receptive difficulties. Next, we have the characteristic of speech or language impairment. First is improper use of words and their meanings. Second, inability to express ideas. Third, inappropriate grammatical patterns. Fourth, reduced vocabulary, and the fifth is inability to follow directions. So those are the characteristics of a speech or a language impairment. So next we have the disability causes. So these are the causes of speech or language impairment. Some causes of speech impairment is brain damage, autism, malfunction of the respiratory or speech mechanisms, malformation of the articulators, physical or organic problem, stuttering, and voice problems. Next, some causes of language impairment is the brain injury, genetic causes, autism, ear infection, no appropriate role models, left alone often, not spoken to frequently, or punished for speaking, and last is ignored when they try to communicate. So next is the assistive technology. These are the augmentative and alternative communication or the AAC devices. So these devices can help the people with communication disorders to express themselves, and this also range from a simple picture to a computer program that synthesizes speech from a text. So this is very helpful for children or a people that has a communication disorder for them to communicate to others.
Traumatic brain injury. Traumatic brain injury is a disruption in the normal function of the brain that can be caused by a blow, bump, or jolt to the head suddenly and violently hitting an object, or when an object pierces the skull and enters brain tissues. Major causes of traumatic brain injury: 1% of suicide, 11% of assault, 19% of struck by objects, 20% motor vehicle accidents, 21% of others, and 28% for falls. Is it permanent? Injuries can range from mild concussions to severe permanent brain damage. While treatment for mild TBI may include rest and medication, severe TBI may require intensive care and life-saving surgery. How long does it take to recover from TBI? At 6 months, about 60% of TBI patients can walk again. After 1 year, speech and cognitive abilities will have significantly improved. In fact, 64% of TBI patients make a good cognitive recovery after 12 months, according to the Journal of International Neuropsychological Recovery. How do they test TBI? A medical exam is the first step to diagnose a potential brain injury. Assessment usually includes a neurological exam. This exam evaluates thinking, motor function, sensory function, coordination, eye movement, and reflexes. Imaging tests include CTI scans and MRI scans. Cannot detect all TBIs. Soldiers also suffer inordinately from TBIs caused by roadside bombs known as IEDs. The injuries sustained from a TBI vary from a concussion with mild temporary amnesia to permanent coma. What happens if not treated? Sustaining a concussion or any brain injury can lead to changes in cognitive abilities and control of emotions, mobility, speech, and senses. Left undiagnosed and untreated, a TBI can have a huge impact on how a person thinks and acts, and on his or her mental health. Developmental delay. Developmental delay refers to a child who has not gained the developmental skills expected of him or her compared to others of the same age. Delays may occur in the areas of motor function, speech and language, cognitive, play, and social skills. Symptoms of developmental delay: delayed rolling over, sitting, or walk, poor head and neck control, muscle stiffness and floppiness, speech delay, swallowing difficulty, and clumsiness. Can developmental delays be cured? Treatments from developmental delays vary according to the specific delay. Some treatments include physical therapy for help in motor skill delays, and behavioral and educational therapy for help with ASD and other delays. Causes of developmental delay. It is in genetic or hereditary conditions like Down syndrome, metabolic disorders like phenylketonuria, PKU, trauma to the brain such as shaken baby syndrome. When should I be concerned about developmental delays?
Contact your child's doctor if your child has any of the following signs at age that's indicated. In addition, watch for any loss of skills that have already been learned. By 3 to 4 months, contact the doctor if your child does not reach for, grasp, or hold objects.
So, we are done to the disabilities categories of IDEA. And now, let's proceed to the DepEd categories. DepEd, it continues to provide the necessary educational interventions for learners with exceptionalities through its Special Education or SPED program. The SPED program of DepEd, it provides a holistic approach in catering to the needs of learners with various exceptionalities. And this program, it can ensure that learners with exceptionalities will have access to quality educations by giving them their individual and the unique learning needs. And now let's proceed to the categories that the SPED teachers shall implement. First, the self-contained or the special class, a separate class for only one type of exceptionality which serves moderate to severe type of disabilities. Separate class of the type of disabilities. The examples is they have autism, the multiple disabilities, the severe intellectual disabilities, the deafness, the deaf blindness, and the other types of disabilities. Next, itinerant teaching. A traveling teaching reaches out to children with special needs in other schools or at home to provide direct and consultative service. It also called visiting or peripatetic teachers that specialize work in the trades or the field of special educations, and sometimes they providing individual tutoring. And I will turn to the next reporter.
Resource room and pull-out. Now first, let's define resource room. A designated place where a child with special needs enrolled in a regular school program goes to in order to make use of specialized equipment either in a tutorial situation or in a small group session handled by a SPED teacher. So basically, resource room is an environment or area for students who has special needs. It's a separate room or remedial classroom in a school where students with educational disabilities such as specific learning disabilities are given direct attention or immediate attention for academic remediation, specialized instructions, and assistance with homework and related assignments as individual or in a group. In this area, students are able to assess or do their tasks, review and organize class notes with the assistance of the teacher or SPED teacher. Resource room is good because it offers several advantages, like it allows learning goals can be easily repeated as much as needed for an individual student without the pressure to follow student curriculum. So next is pull out. Pull out is a kind of program where the child enrolled in the regular class reports to the resource room for a period of time for special instructions by the SPED teacher. So pull out is a kind of program wherein a group of students usually leave the regular classroom to work with other students who have the same similar ability or interest. Pull out is a program that takes a student out of the regular classroom during the typical school days and places them into alternative programming. They work with students in general education, instructional support, different instructions or related services are provided into that classroom. Pull out is good for the reason that the students receive more attention to the teacher and have more occasions to practice speaking when when giving answers. So that's all. Thank you.
Lastly is the integration and the mainstream. This refers to enrollment of a child with special needs for depth ed. There are two types degree of integration. The first one is the partial integration and the second one is the full integrations. So what is this partial integration and full integration? Partial integration caters special needs enrolled in a special class integrated with regular children in non-academic activities like arts education, physical education, and lastly, the school programs. While in full integration, a child's special needs sets in the regular class in all academic and non-academic classes. For inclusion, all children with disabilities, regardless of the nature and severity of disability, need for related services and receive their total education with regular education classroom. For inclusion, this simply means general education for all child with disabilities and accepting receiving their total education with regular education classrooms.